And so we are going to now turn to two other speakers. One is Dr. Wendy Slusser from UCLA, and following her will be a video presentation by her colleague, Dr. Ted Robles. So let me introduce Dr. Slusser. Dr. Slusser right page on my queuing here, is the Associate Vice Provost of the Semel Healthy Campus Center and a clinical professor at the UCLA Schools of Medicine and Public Health, where she is currently building an inclusive culture of health and well-being for over 85,000 students, staff, and faculty. Her career is dedicated to promoting health and well-being with a keen focus on equity for children, young adults, and their families. She has led pioneering research such as the fruit and vegetable bar intervention study that inspired national policies and campaigns, including former First Lady Michelle Obama's Let's Move Salad Bar to Schools campaign. Dr. Slusser has been instrumental in integrating nutrition education into the training of healthcare professionals across disciplines at UCLA. Dr. Slusser, you have the floor.
Well, thank you so much, Dr. Banks. I'm so appreciative to be here. Really enjoyed Professor Boren's presentation. I'd like to start with just grounding us to the here and now. Can we just take 2 deep breaths in and out? Awesome. Thank you so much. I'd like to start with this animation picture here, animated picture or cartoon. As a pediatrician, I've been asking this question my whole career. How do we place a greater and more sustained and coordinated emphasis on building an inclusive culture of health where everyone has the opportunity to flourish and thrive? And I was invited to join a mission and vision that answered that question for me, called the Healthy Campus Initiative Center. It was launched in 2012 by our Chancellor Block, and the mission really dovetailed into my whole life story about working in pediatrics. We wanted to build a culture of health as a foundation for a resilient, equitable, and thriving community for the over 85,000 students, staff, and faculty, and to inspire others. And it didn't take long. In 2016, former University of California President Napolitano adopted our model and fanned it out across the entire UC system. And how did we do it, or how do we do it? We take a 2-pronged approach: asset mapping and mobilization, and community-centered solutions. The goal is to build on the strengths of anchor institutions. And we ask the question, who and what drives health for the university, community, and beyond? And if you use this, if you use this socio-ecological model, we can answer this question, starting with the students and staff and faculty, and then fanning out to social environment, physical environment, and policy and institutions. Once you've identified your stakeholders, you need to mobilize them. Asset mapping and mobilization, that's the title, right? So how do you start mobilizing? Well, we used the 5 conditions of collective impact to help us with that. In other words, people come in, get invited, or it's inclusive, not exclusive, so anyone could show up, leave their personal agenda at the door, build on a common goal and build measurements, and meet regularly, and magic happens, where you can even co-publish with your transdisciplinary teams, and you co-teach. And we would integrate best practices into operations, trying to really translate research to practice. And this is an example. I used to lead, before I led the whole initiative, I led the food piece, the focus on food. And about 10 years ago, when I started that effort, I brought a whole series of articles, and our team that met together regularly was very transdisciplinary, including the head of housing and hospitality. A couple of months after I brought a series of articles, the director of housing and hospitality, Pete Angelis, said, you know what, Wendy, I read that article that was published in Holland around putting healthier items in the vending machine at eye level, dropping the price and upping the price of the less healthy items. I'd love to try this on our campus, but we're internally operated and I don't want to lose money. And so I said, okay, let's look at what assets we have on our campus, which are graduate students. We identified a really eager graduate student to do this research. He and I, the head of housing and hospitality, and I mentored this student along with a series of other nutrition specialists. And we found, lo and behold, that we could do this experiment just like they did in Holland, and we did not hurt the bottom line, and we also increased sales of healthier items. This actually was published, and this particular study, along with work that's been done at Berkeley, inspired the healthy vending policy that's now UC-wide, which is in part of our sustainable policy program UC-wide. So once we identified the stakeholders, we not only used a collective impact model, we also used other ways of convening and getting ideas and implementing ideas. One of them was summits. We had summits around food, mind, body, health equity, media literacy. And we also promoted transdisciplinary research, education, and programs that then could be translated to practice. This is just an example of a MindWell Summit that we held a couple of years ago. And as you can see, there's a whole series of outcomes that came about from that summit, which really was just a 4-hour summit. And we pulled together leaders in different subject areas, like this one being the MindWell. And we had decision makers, we had implementers, we had people that were on the ground doing the work with students, staff, and faculty. And we've been able to implement many different innovative transdisciplinary work with this kind of a model. Another model is the transdisciplinary research. As many of you know, diabetes prevention program is an evidence-based program that was proven to reduce the risk of getting diabetes if you are pre-diabetic by 58%. And that study was published in the early 2000s, still being translated to practice. We were able to implement it on our campus at UCLA in 2014 and then picked up UC-wide in 2016. And we've had over 2,000, this is the latest data, but we've hit our 2,000 mark as of January, where we've had students, staff, and faculty participate in this program. And as you can see, we've been able to attract a diverse group of employees and faculty, student, staff, and faculty to participate UC-wide. And we've had significant outcomes, of which now all 10 campuses are actually recognized by the CDC for their diabetes prevention program. So the outcomes are fitting high standards in terms of the quality of the program. It's also been able to attract a lot of funding for our researchers here at UCLA and also other campuses. We've received NIH funding and CDC funding based on the program rollout here. And you can see that this is one of our recent publications from the team that's doing the research around that's been funded by the NIH. Another approach of our two-pronged approach, one is the asset mapping and mobilization. The other one is community-centered solutions. How do we do that? Well, we listen to what students, staff, and faculty need and want to allow for more creative and effective solutions to existing health concerns. Our constituents, our stakeholders really know best what we should be doing to help them have better lives where they can come to work, they can leave work healthier than they come. They also developing and designing built environment. I know Dr. Banks has been doing this a lot in regards to let's make the healthy choice the easy choice. And then also we are engaging and catalyzing state, national, and international collaborations. So at this stage, I'd like to give you an example of listening, leading, and collaborating and translating what we hear to practice with a video that Dr. Ted Robles, who's a professor of psychology, and he also leads our Engage Well pod, co-leads it. The Engage Well pod is focused on social well-being. And he unfortunately can't come today, but he did recorded this video so we could hear something that he's done as a leader of the co-pod or the Engage Well pod. So go for it.
All right, thank you for the opportunity to present some of what we've been doing to help build an inclusive culture of health. I do want to highlight that this work on microaggressions in the higher education workplace is really a drop in the bucket in how we can address health and mental health and inclusivity in the workplace. I want to kind of skip to the punchline, which is that the big major takeaways from what I'm going to talk about today are the importance of surveying staff and to find out their experiences, as well as the importance of developing and trying out interactive workshops. This is a project that I conducted as co-lead of the Engage Well pod as part of the Semel Healthy Campus Initiative Center. But I have a number of collaborators, most importantly, Joni Brown, who was our graduate student researcher on this project, Chris Dunkelstetter, who was a co-lead of the Engage Well pod during the time that we did the project, as well as Aaron McMahon, who's the director of UCLA Recreation, who was also a co-lead of our Engage Well pod. And a number of other folks to thank, including undergraduate research assistants, the Semel Healthy Campus Initiative Center, of course, staff assembly, and a number of other units on campus. Before I begin, I want to tell you a little bit about our pod. So our pod was started as part of the larger Semel Healthy Campus Initiative Center in 2017. The Healthy Campus Initiative Center had been already going on for about 4 years prior to that. And my colleague, Chris Dunkelstetter, wanted to start a pod focused on a mission of fostering new social connections at UCLA, enhancing the quality of those existing relationships, and also promoting positive social behaviors on campus, including civility, acceptance, and inclusiveness. And when we decided to start to think about microaggressions in the workplace, that was really in response to the events of 2020 involving racism and injustice in society. It was also a response to a catalytic research funding call by HCI, where they wanted to make UCLA a healthier and more equitable campus for all. And so the goals of this project were, and I'll describe them in a bit, to both just document awareness and experiences of microaggressions among UCLA staff, and also pilot efforts to address microaggressions in the workplace. So you might ask, what is a microaggression? So this is one of the definitions in work by Daryl Wing-Sue, who's a key scholar in this area. These are brief, everyday exchanges that send denigrating messages to people in marginalized groups because they belong to that group. Those exchanges can be verbal, they can be nonverbal, and again, they are to a target person in a marginalized group. Now, micro doesn't mean that the acts are small or innocuous, and it doesn't mean that the impacts of those actions or behaviors are small or innocuous, but it's really that they occur at the kind of interpersonal level, as opposed to something more structural, for example. The aggression part is that the act involves that the act results in harm, even if the person intends to or not. Now, I want to recognize that the current climate over the past year or more regarding these kinds of topics has included pushback. And if you're interested, I invite you to read more recent discussions on this topic at the QR codes. And just to show you some examples of what some of these microaggressions might sound like or look like, you can see them down here on the left. In some ways, you could consider these as a specific form of workplace incivility, and where workplace incivility is low-intensity social interactions that violate norms of respect, where their harmful intent is actually kind of ambiguous. So again, you can learn more by scanning these QR codes to get a much more reasoned discussion about this topic. I do want to point out, since a lot of what we're going to be covering in this conference is related to mental health and just workplace health, the harms of microaggressions. Now, this is all in research that is correlational, so these are not causal relationships where microaggressions cause some of these outcomes. But we know that increased experiences of microaggressions are related to greater internalizing symptoms. So specifically, these are symptoms of depression and anxiety, greater risky health behaviors like alcohol use and smoking, increased negative mood, decreased positive mood, increased burnout, and decreased job satisfaction. And if you want to know more about the harms in the workplace, you can use the QR codes that are on the slide there as well. The effects, or the size of these effects on the outcomes that I just described, is very similar to the effects of perceived discrimination. So what I'm going to do today is I'm going to describe our work during 2021 and 2022 to survey staff and faculty, although I'm really going to just talk about staff today, regarding the prevalence of microaggressions in the workplace. And then I'm going to talk about ways that we piloted workshops to increase awareness and provide skills to intervene. So first, let's talk about surveying staff. So we made an initial invitation that was posted on the UCLA Staff Assembly biweekly newsletter. There were 2 follow-up reminders to complete the survey that were also posted in the Staff Assembly newsletter. And we collected data from July 14th, 2021 through September 10th, 2021. And we had a total of 680 responses, which is very small relative to the overall size of the staff on campus. But this kind of survey data with the kind of resources that we had, as opposed to hiring a research firm that could do random sampling, we weren't able to do that. So you can take some of these findings with that kind of grain of salt. If you look at our demographics in the sample, you can see the breakdowns related to race, ethnicity, gender identity, sexual orientation, and disability status. For the top 2 categories here, race, ethnicity, and gender identity, we were able to compare our demographic breakdown relative to the actual demographics of staff at UCLA. And in the sample, the white Europeans are actually overrepresented relative to their representation on campus, and Latina and Asian Americans were actually underrepresented relative to their representation on campus. That's why they're in that sort of shaded gray. For gender identity, we had overrepresentation of women, underrepresentation of men, and also underrepresentation of people who report themselves as being in additional categories. And then you can see the other demographic breakdowns there. We don't have ways to compare those 2 categories of sexual orientation and disability status to UCLA staff demographics. We asked about experiences with microaggressions using a revised version of this scale called the Racial and Ethnic Microaggression Scale. We modified it so that the questions could cover other identities besides race and ethnicity. So I'm not going to show you all the items here. There are 15 total, and we just sort of averaged them together. But what we did is what I'm going to do is show you the most frequently endorsed items. So one item was someone assumes that they speak a similar language to other people of their background. Someone assumed that I spoke a language other than English. My opinion was overlooked in a group discussion because of my background or social identity. So for the language one, someone assumes that should say I speak a similar language. About 17% endorsed experiencing that once a week to almost every day. For speaking a language other than English, 10% endorsed experiencing that once a week to almost every day. And for feeling overlooked in a group discussion, about 9% of our staff sample reported experiencing that on a daily basis. One of the reasons we wanted to design the questions this way is we could then compare experiences between different demographic groups. So that's what you're seeing here on the left. I know that's really small. We looked at gender, race, ethnicity, sexual orientation, and disability status. Because of time, I'm not going to be able to highlight all 4 categories, so I'm going to focus specifically on gender and then race, ethnicity. And what you see here is, I'm going to orient you to this graph. So the solid black line with the blue band is the average for the entire sample. The gray dots are individual responses, and on the y-axis are different categories. The number here, that negative 0.3, highlights the effect size in comparing the group, the 2 groups. So the group in the top row with the group in the middle row there. So that negative 0.3 is a 1/3 of a standard deviation difference. Basically, men on average reported less frequent microaggression experiences compared to women. And men were below the mean for the entire sample. Compared to white European Americans in the sample, Latine, Black, Asian American, and other ethnicity groups all reported more microaggression experiences. And then just note here the effect sizes, large effect size for Black African Americans, and you can see the groups that are considerably above the mean, particularly Latine and Black African American. And so you can see across the different categories, the different experiences that people are having based on their racial, ethnic, or gender, sexual orientation, or disability status. We didn't have any mental health outcomes in the study. The main outcome that we could look at was job satisfaction. So people rated overall, I am blank with my job. Either 1 equals not at all the way up to 4 equals very. And job satisfaction can be influenced by multiple factors, including things like age, education level, career versus being a limited or contract employee, job length, or being full-time versus part-time. And so we controlled for those potential confounding variables in our analyses. And so we looked at multiple measures related to microaggressions. So the items that I showed you before, the scale that I showed you before, really refer to behaviors. And we had another measure of perceived intent, as well as everyday discrimination experiences, not just at work, but anywhere else in life. Chronic work discrimination experiences, and also the acceptability of racial microaggressions, like endorsing things like racism as a thing of the past. And when you do this, when you put all this together in the analyses, the only covariate that was related to job satisfaction was age. Green indicates that higher age was related to higher job satisfaction. And when you look at the variables above, greater behaviors related to microaggressions, perceived intent, those were related to lower job satisfaction. And then the only other measure related to lower job satisfaction was chronic work discrimination experiences, like feeling like you're not taken seriously very frequently, or reporting that you have to work twice as hard compared to other people. So to sum up this portion, about 10% of staff reported weekly to daily experiences with microaggressions related to people making assumptions about language or feeling overlooked because of social identity. Certain groups experienced more than others, and those experiences contribute to lower job satisfaction over and above other job-related factors. And we didn't measure mental health in the study, but we know from other work that these also have, these experiences can also be detrimental for mental health. Okay, in the remaining time, I wanted to talk about our efforts to develop pilot workshops to increase awareness of microaggressions and provide skills to intervene when they happen. So to learn more about the state of the science, check out this QR code. This is an article by Elisa Fedoracci, who was actually worked at UCLA for a time before attending grad school at Rice University. And to quote her, "Empirically informed workplace microaggression interventions are needed. As a first step towards eliminating subtle interpersonal bias at work, employees need to understand what microaggressions consist of and that they're unacceptable, and then they need to know what to do about it." And so we piloted 2 sets of workshops informed by Daryl Wing-Su's work, focused on the following learning objectives. An awareness workshop where attendees should be able to explain what microaggressions are, understand their impact on others, and then a micro-intervention workshop, which has to do with becoming familiar with strategies for intervening with microaggressions, and then describing factors to be mindful of when you're making decisions to intervene. Our awareness workshop was 1.5 hours over Zoom. We did 3 of these workshops, about a dozen staff each. And then for our intervention workshops, we only did 1 of those. We were only able to pilot 1 of those during the time that we did this project. Common elements across these workshops were defining and reviewing specific concepts, reviewing and discussing content, so like videos, case examples, and then sharing examples in de-identified ways. In the awareness workshop, we started with definitions and key concepts. Some of this was reviewing videos and then discussing them. We then had participants provide anonymous examples, which they discussed in small and large groups. And then we concluded with a couple of more videos, which we then discussed at the end. In the interventions workshop, we focused on 4 key skills from a recent book by Gerald Wing-Su: making the invisible meaning of what somebody's saying visible, disarming the microaggression, maybe like interrupting what's happening, or kind of stopping the action so that more harm can not be done, educating the perpetrators, or sort of informing them about how what they said had an impact on others, and finally providing resources, so that whether that be workplace resources, and so that to help deal with these kinds of situations. We also discussed additional considerations like when, where, and how to address the offender, who the offender is relative to you, and the cost versus benefits of action and inaction. And so here's some of the comments from the attendees. We got a lot of positive input and feedback about people wanting more, but that they learned a lot during the discussions. Our next steps are, one, we've handed off our kind of pilot outlines and lesson plans to our EDI office, and in the hopes that they will sort of take that up. We can't scale up these kinds of interventions at the campus level, but our hope is to sort of seed other groups to be able to do that. There are online implementations through learning management systems that are available, though I will say that based on our experience in doing this over Zoom, my strong preference is to do this in person and have very immersive experiences. Those are really where you get a lot of one of the valuable aspects of doing this in a workplace was that people got to learn about each other, even though they'd known each other for a while. Some folks were horrified over the experiences that some of their colleagues had gone through. I found it valuable to learn about those. So thank you for the time today. This was our effort to make a small dent in improving workplace mental health through addressing microaggressions in the higher education workplace. Surveying staff is one really important way to start figuring out who's being impacted and how. If we had to do this again, I think we would look at mental health outcomes. And then, of course, piloting interventions to help folks who are in need. So thanks for your time. I'm going to turn things back over to Wendy.
Well, I want to thank Ted for his incredible presentation, and I'd like to move on to just the end of the whole presentation that we're offering today. Just like Ted said, one way to make an impact in your community is to listen and learn and then try things out. Another way is to bring diverse stakeholders together. And we've been doing that since the Healthy Campus Network was implemented UC-wide in 2016. And an example of this is a UC-wide emotional and social well-being meeting that we held in the fall of 2023 that was focused on an interdisciplinary collaboration. And we looked at the upstream determinants of mental and emotional and social well-being. And at the end of that first day, we came together as a group. There were over 60 of us from each UC campus and other campuses, the Cal States and the community colleges. And we voted on our priorities. And this is an example of the priorities we voted on. And in our past experience of these kinds of UC-wide meetings, once we do that, we can then pull together resources and work towards actually implementing these priorities on our campuses and reflecting our own needs and also our own culture. So focusing on the UCLA community and the UC-wide community is our core mission for Semel HCI and Healthy Campus Network. But at the same time, we believe, like a tree, we can grow our branches and become collaborators at the state, national, international levels to inspire effective and equitable change. And as you can see, we've been able to work on our sustainability goals that I've told you about UC-wide. We've joined the Total Worker Health Affiliate Program, UCLA, and UC Davis has, and I know UC Irvine, UC Berkeley, they're all part of that program based on their certain centers. We're UCLA-wide and UC Davis-wide, where we've joined on that program. We're also advising President Drake's system-wide staff wellness program work group and working with the state. And we've also signed, UCLA has signed on to the Okanagan Charter, so has Berkeley, so has Irvine, and Davis is working on it. So to conclude, we believe in silo busting and creating transdisciplinary inclusive collaborations where we build trust and everyone has a voice at the table. And this final slide illustrates just some of our partners that we have participated and collaborated with at UCLA and then beyond. Special thanks to some of the supporters that got us going in the first place: Jane Terry Semel, Chancellor Block, former UCLA Executive Vice Chancellor and Provost Scott Waugh, and Mike Levine, and our current EVC and Provost Darnell Hunt, Marcy Rothman, Uni Health Foundation, and Lowenstein Foundation. I want to thank you all for listening to our presentation. We're really grateful. We would welcome recommendations, suggestions, collaborations, and open for questions or whenever that lands.